A 47-year-old father reached for the same little bottle of over-the-counter eye drops every single morning for almost 2 years, chasing the clear white eyes it promised, and it was slowly choking the blood supply to his retina. If you want more real medical cases that could protect you and the people you love, consider subscribing. The bottle was nafazoline, an over-the-counter redness reliever. You can buy it at any pharmacy, no prescription, no questions. He liked what it did. A couple of drops, a few blinks, and the red faded out of his eyes. They looked clear, awake, white, the way eyes are supposed to look in a photo. So he used it every morning. On the bathroom shelf, in the morning light, he would reach for that small white bottle, tilt his head back, and let a drop fall into each eye. It became automatic. Coffee, then the drops. For almost 2 years. He was, in every other way, unremarkable. A 47-year-old man with shoulder-length light brown hair, warm hazel eyes, a friendly, approachable face with subtle laugh lines around the eyes. Average build. A plain, neutral tone everyday top. The kind of face you would trust to hold the door for you. Nothing about him said patient. Here's what a doctor would write in his chart. A 47-year-old man we'll call DR, presented with blurry patches, worsening eye redness, and a creeping dimness. 3 symptoms, each one small on its own. Together, a pattern. And there is one word he would hear again and again in the weeks that followed. Ischemia. It sounds clinical, cold, hard to place, right? But it comes apart cleanly from the Greek. Ischein, meaning to hold back, and haima, meaning blood. Put them together and you get the whole story in 2 syllables. Blood held back. Hold on to that. Blood held back. Because that is exactly what was happening behind DR's eyes, and he had no idea. It started small, blurry patches drifting across the lower half of his right eye's vision. Not a total loss, just a smudge that moved when he moved, like looking through a fogged window that would not wipe clean, no matter how hard he rubbed. He blinked. He squinted. He assumed it was tiredness or dry eyes or smear on his glasses. If you have ever used redness relief drops, watch closely. This is where it begins, because here is the trap. The moment the drops wore off, his eyes came back redder than before. Redder than ever, not back to normal. Worse. So what did he do? He used more drops. Redness, then relief, then more redness, then more drops. The very thing he was using to fix his eyes was making them worse, and the fix felt like it was working every single time. Redness, blur, a creeping dimness, feeding on itself, tightening its own knot. And this is the question that should be sitting in your chest right now. How does a bottle you can buy at any pharmacy, a bottle marketed to make your eyes look healthy, hold back the blood in a man's eye? How does something that harmless throttle the flow to the retina, the tissue that lets you see it all? We will get there. But first, the morning it stopped being subtle. DR woke up, and a gray curtain had dropped across most of his right visual field. Not a smudge, not a patch, a curtain. He reached up, one hand near his right eye, and he blinked, and blinked, and blinked again. It would not lift. So, DR went to the emergency room. And for a few hours, the team's first treatment seemed to be working, the swelling easing, the field brightening, as if his sight was coming back. For a few hours in the emergency room, it looked like his sight was coming back. His eye pressures read manageable, the swelling seemed to respond to treatment, and the gray curtain across his right visual field began to brighten at the edges. Everyone breathed. Then the field narrowed again, the dimness crept back in, and the fear returned with it, because whatever was starving his eye had not been stopped, only paused. That is the part that scares clinicians. Not the crisis itself. The relapse, a problem that responds, then comes back, is a problem you have not understood yet. You have only pushed on it, and whatever was throttling the light in that eye was still there, waiting the moment the treatment loosened its grip, so the doctor stopped treating the symptom and started hunting the cause. To understand what was happening, they had to rule things out one by one. Follow the clock with them, because in medicine, how fast a symptom appears tells you what to suspect. Seconds means vascular, a plumbing problem, something in the blood supply. Days to weeks means infection or inflammation, something angry and swelling. Years means slow disease, something creeping. Candidate 1, a stroke of the eye. In the retina, a sudden, seconds-fast loss of vision usually means a central retinal artery occlusion, a clot lodged in the single vessel that feeds the light-sensing tissue. The pipe closes and the field goes dark almost instantly. It fit the speed, so they went looking for the source. They scanned the carotids, the big arteries in the neck, and they checked the heart, the usual launch pad for a wandering clot. Both were clean. No blockage to throw a clot from, no clot lodged in the eye's artery. They dismissed the occlusion as the primary driver. Candidate 2, optic neuritis, inflammation of the optic nerve, the cable carrying vision from eye to brain. That plays out over days to weeks, blurring and dimming as the nerve swells and misfires. It matched the slower, creeping quality of his story better than a stroke did. So they scanned the nerve and tested for the inflammatory and demyelinating patterns that drive it. Nothing lit up, no inflamed nerve, no telltale markers. Set aside. Candidate 3, the slow diseases. Glaucoma, where pressure builds over years and quietly kills the nerve fibers, or a slow-growing tumor pressing on the visual pathway. These crawl. They fit a timeline of months and years, not one bad morning. The team weighed them, checked the numbers, and set them aside too. 3 candidates raised, 3 dismissed. And the vision was still fading. Something was starving that retina, and none of the usual suspects had done it. Then they went back through his history. Slowly, the way you reread a page when the answer has to be there and you missed it, and there it was, buried in the ordinary, the thing he never thought was worth saying out loud. Here's the detail he never thought was worth mentioning, the one that changes everything. Eye drops, the little bottle of vaseline he reached for every single morning, for redness, every day, for nearly 2 years. He had not hidden it. He simply did not think of it as medicine. It was a habit, like coffee, like brushing his teeth, something you buy off a shelf, no prescription, no doctor. Harmless, or so it looked. And that is where Occam's razor points. When a list of complicated explanations collapses under testing, the simplest one that fits usually wins. A daily bottle for 2 years, dripping onto the exact eye that was dying. The simplest answer was the one he brought in on his own history. The bottle was the answer, but not because a chemical simply irritated his eye. To understand how a redness reliever you can buy anywhere could throttle the blood feeding a retina, you have to follow naproxen back to its class, imidazoline vasoconstrictors, and to the pharmacology worked out in the mid-20th century, and to the cruel trap that made him use more of the very thing destroying his sight. Naproxen back to its class, imidazoline vasoconstrictors, medicines whose pharmacology was worked out through the mid-20th century. They are alpha adrenergic agonists, molecules that latch onto receptors and make the tiny muscles wrapped around blood vessels squeeze. In the eye, that squeeze clamps the conjunctival and episcleral vessels, and the redness vanishes. Clear, white, awake eyes in seconds. That is the promise in the bottle, but the promise hides a trap. Here's the trap. When you squeeze a blood vessel shut over and over, the vessel does not simply give up, it fights back. Chronic use makes those vessels dilate harder the moment the drug fades. Wider than before, redder than before, so the eyes that looked clear at 8 in the morning look bloodshot by noon. Worse than they ever were without the drops. And what does a person do when their eyes turn red? They reach for the bottle again. That is rebound hyperemia. Rebound because the vessels bounce back bigger. Hyper meaning excess, emia meaning in the blood. Excess blood rushing back into vessels that were squeezed shut. This is why it feels like the drops stop working and why stopping feels impossible. More drops. Tighter squeeze. Redder rebound. More drops again. A loop that tightens on itself, one morning at a time, for almost 2 years. And every squeeze had a cost deeper in the eye, not just the surface vessels you can see. The sustained vasoconstriction throttled perfusion to the retina and to the delicate vessels that feed it. The light-sensing cells at the back of the eye need a steady flow of oxygen to work. Choke that flow and they starve. Think of a garden hose feeding a thirsty lawn. Kink the hose and at first the grass looks fine. Kink it every single day, and the water never fully reaches the far corner. Slowly, quietly, that patch of lawn browns. Then it dies, and a lawn you cannot revive. That was his retina. That was the blood held back. Ishain, to hold back. Haima, blood. The word he kept hearing finally made brutal, physical sense. Back in the hospital, DR's condition finally had a name. Ocular ischemia driven by chronic vasoconstrictor abuse, layered on rebound redness. The bottle he could buy at any pharmacy had been slowly choking the blood supply to his own retina. The treatment was blunt and immediate. Stop the drops. Full stop. No tapering the habit. Then treat the pressure inside the eye and the inflammation and monitor him over the following weeks. And the acute crisis did settle. The gray curtain lifted from the parts of his field that could still be saved. The redness, finally starved of the drug that fed it, calmed on its own. But some of the damage was already done. The light sensing cells in the lower field of his right eye had been starved too long. They did not come back. Partial, irreversible vision loss, a permanent dark patch across the bottom of everything that eye sees, from a bottle that cost a few dollars and promised the opposite. Here's the part that matters for you. Every redness relief drop of this kind carries a label warning. Do not use more than 3 to 4 days. Not a suggestion, not fine print for lawyers. That instruction exists because the people who studied this drug knew exactly what chronic use does to the vessels of the eye. 3 to 4 days. After that, the rebound starts winning. Check the bottle in your bathroom right now. The warning is printed there, and most people have never read it. If your eyes stay red past a few days, that redness is telling you something, and the answer is not another dose. See a doctor. Do not just redose. Redness that will not quit is a signal, not a problem to spray away. He reached for that little bottle every morning because it made his eyes look clear, and it did for a while. The cost came later, and it did not come back. And that is the story of how a father's daily eye drops slowly choked the blood supply to his retina and cost him part of his sight forever. This has been a medical case study.